Welcome to this instructional video on the safe evacuation of a pregnant mother in labor. In this video, we will guide you through the step-by-step process from the time a decision is made to refer the mother to when the mother is handed over at the receiving health facility. We shall focus on a general mother in labor without specifically aiming for any complication or condition. Reference for the various conditions in pregnancy and childbirth will be made to the essential maternal and newborn clinical care guidelines. This video resource emphasizes the following. First, notification. Notification of the receiving facility should be done for all pregnant women to be transferred. Second, utilization of the local maternity and neonatal system. The local maternity and neonatal systems are regional reproductive maternal, newborn, child and adolescent health service delivery accountability platforms premised on the regional service delivery frameworks. The aim is to catalyze the delivery of reproductive maternal, newborn, child and adolescent health services. Local maternity and neonatal systems are comprised of the coordinator, biostatistician, regional referral hospital community health department, lead midwife, regional quality improvement focal person, and a regional emergency medical services coordinator. These platforms play a role towards building a functional healthcare system and coordination of health service delivery within the regions. Third, early referral. Early detection of pregnancy complications and timely referral of pregnant mothers saves lives.
I want to emphasize that referral is an important component of patient management, and in this case for pregnant women, it's very important because it improves the outcomes both for the mother and the baby, and it also enables us to reduce on the delay of having the mother receive critical life-saving interventions. It's also important that this process is well coordinated from the start, and the entry point is the referring facility to be able to counsel and appropriately evaluate the mother they are referring to a higher site, higher level of care, and there should be also appropriate communication, we call it pre-referral communication, between the referring facility and the receiving facility.
Obstetric emergencies are life-threatening problems that develop during pregnancy, labor, or childbirth. Every pregnancy and birth is unique. While pregnancy is a time of happiness and anticipation, it can also be a period of anxiety and concern. For a smooth transition from life in the womb to life outside the womb, a delicate balance between the mother's health, the course of pregnancy, and care during labor is essential. When obstetric emergencies occur, pregnant mothers are referred to a higher level facility to have access to comprehensive emergency, obstetric, and newborn care. Every day in 2020, almost 800 women died from preventable causes related to pregnancy and childbirth. A maternal death occurred almost every 2 minutes. About 95% of all maternal deaths occurred in low and middle income countries, most of which could have been prevented. Sub-Saharan Africa alone accounts for 70% of the maternal deaths. The maternal mortality rate of Uganda stands at 336 out of 100,000 live births, way above the global target of 70 out of 100,000. The major complications that account for nearly 70% of the maternal deaths are severe bleeding, infections, high blood pressure during pregnancy, and unsafe abortions, even in Uganda. To prevent maternal mortality and morbidity, timely management by a skilled health professional with early identification of complications and early coordination, safe referral is necessary. This ensures that all women have access to respectful and high-quality maternity care during emergency referrals. Every pregnant mother deserves a positive pregnancy experience to ensure that the mother and their baby reaches their full potential for health and well-being. Let's get started.
Initiation of patient transfer. Confirm that the client has an indication for referral. Choose a potential receiving facility based on the anticipated needs of the mother and the baby. Utilize the local maternal and neonatal system to assist with the selection of the optimal facility. Verify that the selected receiving facility has the capacity and agrees to receive the mother. If they cannot accept the mother, contact an alternative receiving facility until an accepting facility can be located. Communicate directly with an appropriate provider at the receiving facility prior to departure to describe the mother's and fetal condition, care provided, and anticipated needs at the receiving facility. For severe and critical cases, communicate with a specialist or a medical officer at facilities without specialists for a proper plan of care prior to transfer, during transfer, and at the receiving facility. Remember to document the name and contact of the receiving provider on the referral form. Preparation of the mother prior to ambulance team arrival. Obtain informed consent. Review the risks and benefits of the transfer with the mother, family, and receiving facility. Ensure that the mother and family are aware of the reasons, plan, and destination facility. If the mother or family declines the transfer, an informed refusal should be documented in the medical record. Record the family contact in the referral form to aid communication between the family and the patient. Secure intravenous access with 2 large bore cannulae. You must consider the risk versus benefit of delaying or deferring transfer. Repeat the assessment for clinical stability immediately prior to transfer. Coordination with emergency medical services team for safe transfer. A well-filled referral form having demographics, parity, clinical presentation, and all interventions should accompany the patient. Include all investigation test results. Consider giving important medication doses early or before departure if they will be due during transport or just after arrival. For the various medical conditions, refer to the essential maternal and newborn clinical care guidelines. When calculating transport time, consider possible barriers to safe transfer, such as road closures and weather conditions both current and in the near future. Check that there is adequate fuel for transport. Ensure that the ambulance has a maternity kit, in addition to relevant medicines, oxygen, and other supplies. Ideally, the ambulance team should be trained in basic emergency obstetric care and positioning. The ambulance team must have an ambulance patient care form to document care during transfer. During transit, the healthcare worker should continue to monitor and care for the mother and fetus. Document the findings and care provided in the ambulance patient care form. Handover. On arrival at the receiving facility, conduct a formal handover of the patient to the receiving team by giving a verbal summary, including key information on the labor care guide. This process takes less than 5 minutes. The receiving healthcare worker signs on the field patient care form and retains a copy. The referral form and other patient medical records or investigation results are handed over as well. The goals of a safe handover are to share key patient information, transfer care and responsibility to another provider, ensure thorough but efficient transmission of information, and to give an opportunity for clarifications. In conclusion, early identification of pregnancy complications is key in optimizing outcomes. The coordination of healthcare and referrals should utilize the regional local maternity and neonatal systems depending on the pregnant mother's or fetal needs. Every pregnancy and childbirth is unique and should therefore be treated with utmost respect and dignity even during referral.